Thank you for the opportunity to talk about this project. So this is an SSPC industry collaborative project, and it involves 5 of the pharmaceutical companies, Pfizer, Lilly, Janssen, BMS and MSD. And the idea of this project was to generate data to show that it was feasible to reuse protein A resin for multiple drug products. So I know we have a mixture of people who work with small molecule, big molecule, different actives. So just protein A chromatography is the first, one of the first steps in the purification of your protein or your antibody from your feed stream, from your supernatant, from your cells, where you're producing your target protein, your target drug product. It's essentially affinity chromatography. So you have protein A immobilized on your resin. That binds your Fc fragment on your antibody, and then everything else can flow through the column. It allows you to separate your product from the host cell proteins and the other cell debris. So currently, the current practice in industry is you pack your column, and these columns are huge. Any of you who've ever been on Eli Lilly site or Janssen or wherever, they're huge. And so you pack your column with your protein A resin, you run your feed stream through it for your one drug product, and once you finish with that drug product, you throw your resin in the bin. Okay? Hence, you can imagine the sustainability aspect to this project. Why does it matter? Well, protein A resin is expensive, and the protein A chromatography purification step pretty much accounts for about 50% of the downstream cost of developing or purifying your drug product. And the columns are often discarded at less than 10% of their lifetime. So in other words, you could use that column for a lot longer, but the problem is the company is finished making that drug product. They've made as much as they want. They throw their protein A resin in the bin. So this is not a new concept. There's a couple of papers out there talking about reusing protein A resin, but unfortunately, there's not a lot of data to show that it's feasible. Okay, so our goal was to generate some data. What we wanted to do was run 2 feed streams, so feed stream A and feed stream B, down the same column, and we wanted to check that we didn't get any crossover or carryover or contamination from one feed stream to the other. Why haven't industry just gone ahead and done this? Well, there's several challenges. You want to clean your column each time between each run, and typically you use a caustic phase, so sodium hydroxide, maybe anywhere from 0.1 to 0.5 molar. You want to be sure that NaOH solution is strong enough to remove the risk of any carryover going from one product to the next, but you also don't want it to destroy your protein A resin. Okay, so you don't want it to reduce significantly the lifetime of the resin. The other issue is that there's not confidence that the current analytical techniques used in industry are sensitive enough to detect the carryover. So we want to build that confidence. Again, many probably familiar with chromatography, but this is your typical chromatography purification process. So you load your feed stream onto your column, you wash, so that the target protein, your target drug product, sticks onto your column, binds to the protein A, you run a PBS wash through, so you remove everything else, then you change your mobile phase to an acetic acid elution phase, out comes your drug product. You then do that cleaning CIP wash with your NaOH and a PBS equilibration phase. So our partners, the 5 companies on this project, all had input to how we set up the concentrations, the flow rates, and the columns we used. So we were trying to get a purification process that would be best practice in industry. So we had a lot of input from the partners. Then we would take our purified drug product and we would first of all do a yield recovery. So essentially we got a quantitative HPLC protein A column. We actually got a prototype column from Glantro, which we used for this project. And we would first of all measure the amount of drug product in the feed stream, then measure the amount of drug product in our purified sample, and we'd be able to get the yield recovery. We then concentrated our recovered drug product, and we did some analysis. So we used capillary electrophoresis SDS page, again used commonly in industry. We wanted to check for product integrity. have we fragmented our protein? Is there any heavy chains, light chains, anything changed in our product? And also to check, can the CESDS detect any carryover from the previous product? And then, like I said, we wanted to be sure we were using sensitive techniques that if there is any carryover, that we can see it. So we trialed a couple of different mass spec techniques, but we ended up sticking with the LC-QTOF. We designed a multi-product protein A resin reuse protocol. So essentially we bought in 4 small columns. We're talking 1 mil columns here because we don't have a lot of feed stream, but we very generously, the companies involved donated some feed streams for us to use. So we got 4 columns from Cytiva. We went with small columns because of the limited amount of feed stream. We asked for the 4 columns to be packed with the exact same batch of protein A resin so that all the columns should be identical. And then we took each column and, for example, column 1, we ran blue as product A, so a run with A, and that's that whole purification process that I just showed you on the previous slide. Then we ran these 2 dots are a blank run where we just inject PBS. Again, another product A run. This was just when we were setting up our purification process. Then we ran 15 runs with our developed purification protocol, blank run, and then we did a changeover to product B. And then we did 3 runs, then we did another changeover and back to product A. Note, whenever we did a changeover, we actually increased the strength of our CIP, our cleaning wash, to 0.5 molar NaOH. And just note, initially, at this point, you can see it on both columns, we initially were running our CIP with 0.1 molar NaOH. Again, we wanted to minimize aging on our column, but we actually detected carryover from the previous product. So in the blank run. So the idea of this blank run was we would inject it, we would have done a CIP at 0.1 molar, we inject our blank run, and we still saw something from the previous run. So we switched to 0.2 molar in between runs. So in between each of these runs, the CIP in that purification process is 0.2 molar NaOH, but at the changeover, when we went from one product to another, the CIP was 0.5 molar. Okay? We did a DBC, so a dynamic binding capacity, on our column before we started and at the end to see if it had changed at all. And I'll talk about that in a minute. So the analysis we did, like I said, we were using the HPLC, the quantitative HPLC for yield recovery, CESDS to check product integrity and carryover, and then LC-QTOF for carryover. And when I say carryover, we were looking for the target drug product carrying over, but we were also wanted to check in case there was any host cell proteins from feed stream A that we're suddenly now seeing in feed stream B, in the product B, in the purified product B, etc. So in terms of yield recovery, you can see here that this is column 1. So this is the column where we ran feed stream A, blank run, feed stream B, blank run, feed stream A. Our yield recovery was a little erratic, but also it decreased hugely at feed stream A. So there was a decrease in recovery observed after the second changeover, and this was unexpected. It was even more unexpected when we saw column 2, where we didn't see any decrease in the recovery yield. Now, column 1 and column 2 both had were exposed to the same amount of sodium hydroxide. So it wasn't related to the sodium hydroxide. We don't know yet what happened there. This is an N of 2 columns, so it could be that one column there was a bit of compaction in it, or we want to take apart the column and analyze the resin, or it could be that there's something in feed stream A, because this column would have been exposed to more feed stream B than A, and column 1 the opposite. So that's still something we're exploring. We did do the dynamic binding capacity. So here what we're doing is we flow feed stream onto it. So we load our column with our feed stream, and we look at what's coming out of the column, and we measure, using our quantitative HPLC column, how much of our drug product is coming out. So you can see up until you've flowed on about 80 mils of your feed stream A, you're not detecting, this is your IgG peak, so this is your drug product, your antibody peak that you're trying to purify. You're not seeing any, and then suddenly you start to detect it. And basically what's happening is your column now is filled to capacity, it's saturated. Okay? And that gives you your dynamic binding capacity. How much protein, or how much antibody can my column hold? And essentially, we measured this 10% DPC. So you can extrapolate your curve up. Eventually, what should be coming out is the initial quantity of your drug product that was in your feed stream, and you measure this 10% DPC. So initially, our 10% DPC on column 1 was between 84 and 88 milliliters. After all those runs, so about our initial 2 runs of product, of feed stream, and then essentially, I think it's 19 runs in total, we did another DPC, and we saw a decrease of about 1/3 of the DPC was lost. So our DPC now on column 1 was between 54 to 58 mils. If we look at column 2, so again, this was mainly product B on column 2, we didn't see the same decrease. So here you can see 10% DPC was about between 117 and 121 mils, and after all the runs, it was had lost about 1/8 of the DPC. So again, just a reminder, both columns were exposed to the same NaOH, but we're not quite sure why this is. It needs further exploration, but through all our runs, we were never exceeding the DPC. So all of our antibodies should have been able to bind to our column, and so it didn't account for that loss in yield either. So again, it's just a little nuance at the moment. So essentially what we were mostly interested in was this carryover. So like I said, we started with the CESDS to check for product integrity and carryover. When we look at product integrity, so this is like the profile that you get from the CESDS. And here you can see, it's like your typical kind of chromatogram, but essentially your main peak, which is your IgG, and you can see it here. This is for product A, and over here for product B, okay? This is the relative migration time, and this didn't change over time. So this is our intact protein. Now there were 2 peaks here for product A. That was the same at the start and at the end, so it's not related to the multi-product reuse. All we can say is it's probably related to our sample prep. We concentrated the product A sample to do the CESDS. It didn't change, and so we integrated this whole peak to determine the peak area and the product integrity. These smaller peaks here, very small quantities, you see them over here, they're just our light chains, our heavy chains, and so essentially these didn't change over time, over the multiple runs when we did the changeovers. So we can conclude from that, you can see there just the percentage of integrity, column 1, column 2, product A, product B, product A, product B. The changeover procedure had no influence on the integrity of the products. So that's great. We then tested for carryover monitoring. And there's a nice paper by Charnez et al., which does something similar. And that's where we got the idea of running the blank run in between after you've cleaned your column and checking for any carryover. So we did that. So you can see here, after the runs, we did a quantitative HPLC for yield recovery after every single run. That's the pale blue circles. But the other analysis, the CESDS and the LC-QTOF, we only did a couple during the build-up of these 15 runs, and then we did them more frequently towards the end. They're just a lot more labor intensive for sample prep, etc. So here you can see your CESDS. So where we are for this first run of CESDS, we're at that blank run after we've just run feed stream A, and you can see the baseline. Remember, our migration time for our intact protein was around the 2.3. We don't see anything. If you zoom in, you still don't see anything. It's just noise. Same for column 2, where we first ran feed stream B. Again, that blank run, you're not seeing anything. And again, just to show, it was the same all the time. We didn't see any carryover by CESDS. And you can see here, this is the blank run after so we did the switchover, and then we cleaned again, and we're at this blank run, and again, no carryover. Okay, so that was good. Great, we thought there's no carryover, nothing wrong with using your Protein A resin for more than one product. But we wanted to explore a more sensitive technique, because it's fine, it's very difficult to prove a negative. So I'm telling you there's none because I can't see any, but are there really none, or is my technique just not sensitive enough? So we went to our LC-QTOF. I won't talk about the sample prep here just because I don't have time, but these are just your TICs from the liquid chromatography. So you can see your peak intensity against your acquisition time. This is product A cycle 1. okay? And these blue arrows represent peaks in your chromatogram. It's the same as any other chromatogram, there's just a lot of peaks. When you're preparing your sample for QTOF mass spec liquid chromatography, you fragment it, you chew it up with trypsin or alpha-chymotrypsin, and we explored using both, and we fell on trypsin at the end. And so it breaks it up into peptides. And then your chromatography separates out all these peptides into these peaks, and then these peaks individually go in and get broken up in, and you can measure the M/Z values for them. So there's distinct peaks that are there for product A that are not present in product B, and then equally you've peaks here, this red arrow, it's not present in product A. So basically you've unique peaks. So this was just evaluating by eye. And when we look at the changeover, so this is the first changeover, so the top graph, the top chromatogram here is your column 1 when you first switched from A to B and the first cycle of B, and you can see you can't see any peaks from product A. And equally on column 2, when you switch to product A, you can't see any peaks from product B. But that's just by eye. So we wanted, again, sorry, I should say, the third batch, so the second changeover, where you went back to the original feed stream that was ran on the column first. Again, it looked like, yeah, don't think we're seeing anything. But the M/Z, the mass detection, is much more sensitive, okay? So we went to look at the actual sets of masses, the M/Z that are detected. And what we did is we created 2 data sets of mass which were unique for product A and product B. So we took runs from, say, cycle 1, cycle 10, cycle 15 on column 1. Remember, that's just when feed stream A has been run on the column. We did the same for column 2, where just feed stream B has been run on the column. So we generated these unique list of masses, and then we searched, we developed an algorithm to search for those masses in the first changeover run, so product B on column 1, and also we'd search for the product A unique peaks on column 2 when we had first switched over, on the second switch over back to product B on column 2. And then we did the same on column 2 where we searched for product B in product A and vice versa. And we did find carryover. So we did identify peaks. So again, just to point out where we are in our multi-product resin reuse protocol, here we're looking at the output, the analysis, the LC QTOF analysis of these runs. And we're looking to see, are there any peaks from product A, the blue product, in the runs of product B? And so you can see here, these peaks are actually unique, or sorry, they're from product A. And likewise over here, we're looking at product A, looking to see, do we see any peaks from product B still in here? Now, this algorithm, this was from the first changeover, and if we go to the second changeover, yep, so the second changeover here, again, here we're looking to see, well, can I see any peaks, any masses from this product in here, and vice versa here. And again, this is the list of peaks we saw. This is preliminary data. What it tells us is that there are some M/Z peaks that are appearing, say, for example, here in our product B run after a switchover, a changeover, that we wouldn't have expected to see. Okay? Yep. So what does that mean? It means potentially we have carryover. Okay? But what we want to do is develop our algorithm further, and we want to see, well, those M/Z peaks, are they coming from a peak in our chromatogram so that we can clearly confirm and build greater confidence that they are coming from the previous product? Are they coming from the same fragmentation pattern? And can we even identify what peptide fragment they're coming from? So then is it a host cell protein or is it actually our drug product? The other big point is we can see them, but the QTOF is very, very sensitive, okay? So we can see them, they're there, but are they in such a low level that it doesn't really matter, okay, because that's what we're hoping. But we don't know yet. All we have is a qualitative yes, no, and yes, there is some carryover. So in conclusion, Protein A resin can be reused for multiple antibody products with optimization of the cleaning procedures to reduce risk of carryover, but you're trying to limit the impact on the column lifetime. State-of-the-art analytical techniques used in industry, such as CESDS, showed that product integrity was retained and no carryover was detected using the multiple product protein A resin reuse protocol. And that was developed for the purification of 2 IgG feed streams. A more sensitive analytical technique, the QTOF, the LC QTOF, indicated no protein A leakage, and I didn't present that data, but carryover was detected qualitatively. But potentially that could be down at the nanogram per mil level. And again, does that matter? So we're just entering phase 2 of this project. It will start in Q4, coming into Q4, we're already nearly Q4, or maybe we are. And what we want to do is confirm that detection of the carryover by improving our algorithm, not just basing it off the appearance of the M over Z peak, but qualifying that further to the fragmentation pattern, to the TIC chromatogram, determine the levels, so get some quantitative data on it, and identify the source, is it HCP or product, and of course determine if that carryover is actually of significance in terms of drug product quality or would be of relevance for regulatory requirements. So we are recruiting, so anyone who likes data analysis and LC-QTOF, our methods are set up. We will hit the ground running. So the job ad closes on the 8th of September. Who did all the work? It wasn't me. I get to present the lovely slides, which were actually created by Stan. So Stan did all the work on this, the running of all the runs, the sample prep, sample analysis, and the preparation of these slides. The project would not be happening if it wasn't for Aisling. Aisling, this is a project with all these companies, and I know some of them are here today, and everyone from the companies have been very engaged with this, and it's been actually a real pleasure to work on because everyone wanted us to use best practice so that we would generate results that they could actually be of use to people, to each of their institutions. Also a team in UL, Francisco Vitor Santos da Silva. He is now a bioprocess lecturer down in UCC, but Francisco would have helped Stan with the design of the purification protocol and the multi-product resin reuse. Joni McAvenue is a PhD student on an IRC Enterprise Fellowship with Eli Lilly. She did a lot of work providing feed stream initially so that we could get started before we got the feed stream from industry, so from a commercial CHO cell line, and also on the sample prep for the development of the QTOF analysis method. And then Francisco Duarte helped do a lot of the Avant runs for all those 25, 30 runs on the columns. So that's it, and I will take questions after Mike.